At Go Local Live, I'm Josh Fenton, CEO and co-founder. Fourth, last but not least today on Go Local Live, Dr. Michael Fine. He is the former Director of Health to the state of Rhode Island. Dr. Fine, thank you so much for joining us.
Great to be with you, Josh.
Let's go right into the numbers. It's kind of a, we've been on a steady diet of bad news. Maybe there's just a little bit of good news. Not that anything's particularly coming down, but they're just not going up as quickly.
That's exactly right. I mean, the bad news, of course, is we had 4 deaths overnight. And I'm hoping that will be our only 4 deaths for a while, but I fear not because of the number of people in the hospital. However, as you said, the rate of rise of the number of new cases, the rate of rise of hospitalizations is not as steep as it was. It's like the curve is flattening a little bit. It's not flat by any means, but 2 weeks ago we were seeing a doubling in the number of cases per 100,000 per week every week. We are not seeing a doubling now. It has slowed some. I'm hoping that everybody's being a little more cautious. Everybody's now remembering to mask, I hope, and I'm hoping that that's having some effect.
Yeah, I'm not sure I see a lot of masking. Helter skelter. I did walk into a deli the other day and just about everybody had their mask on. That was about the only experience I've seen in which there's been widespread masking, but that's totally anecdotal. The number of new cases were still only at about half the testing that we were doing before. As we all know, testing doesn't have a tremendous amount of value except for when cases are very, very low, and you can be able to be strategic about it. Rhode Island has the unique rankings of being #1 per capita in testing and #1 in the country per capita in cases. So we know what the value of testing without a strategy is.
Yeah, and I keep hoping that we will develop a strategy and do this in a coherent, effective, and consistent way. But remember, we're still at high transmission. Close to 200 new cases per 100,000 per week, way above the 35 or 20 new cases a week that I think tells us that we're in a safe place. And I'm really worried about what happens when we bring this level of transmission with this Delta variant into schools when schools start in 2 or 3 weeks. That to me is the great unknown. I don't know how it's going to play.
Yeah, you'll see some schools back in just 10 days. Some go in before Labor Day, and then we'll see the rest of them go in. There's still really no clarity in the mandating of masking. We've heard a number of things. We've heard Governor McKee says, I'm not mandating it. We've heard the head of the Superintendents Association, their lobbyist, Tim Duffy, saying it shouldn't be up to them. We've heard the Board of Education's committee on K through 12 saying that they're going to reject back to school plans that don't include masking. That doesn't seem to be legal. Their legal counsel says that that's not something that they can enforce. It appears that about 20% of the schools systems have not required masking. So we're void of leadership on this issue. It's become a little bit of a political football between gubernatorial wannabes. This isn't really where we want to be from a leadership standpoint, is it?
No, I think we want to be clear about the need for masking in schools. The American Academy of Pediatrics, CDC, everybody's agreed on. Everybody who knows the science has agreed on it. Why we can't get everybody else to just do it and get it over with is a little unclear, but it's clearly about the politics. And that again reflects the lack of civic trust we have as a nation, and the lack of consensus that we have as a state about how to get together and stop this. Josh, the thing I keep remembering and trying to point out over and over is that community transmission is what matters almost more than anything else. Even if we had the high number of people, the unacceptably high number of people who are unvaccinated, even if we had unvaccinated people, if we had worked hard the moment we saw community transmission start to go up and stopped community transmission from rising to being high, then we wouldn't have these people in the hospital and we wouldn't have these deaths.
But could you in a state that tourism's a principal part of its economy, you've got hubs like Providence, Newport, the Westerly area, we'll go into those numbers in a second. Can you really restrict that without shutting things down?
Probably not. And that's this very difficult choice that we have made and have to make about whether saving lives is more important or whether the economy is more important. And you know the choice we made gives us the outcome that we have.
We went for lobster rolls. I think that is the clear
Big time.
decision we went with.
Big time. And
Let
and the question is, what kind of lobster roll? The Connecticut kind or the Maine? No,
um, Zaco Tacos has unbelievable lobster tacos, by the way. I took down 4 of them last night.
all right.
Dr. Fine, talk about the outbreaks in the communities around the Rhode Island. Who has the highest transmission levels, and what did those say about what's going on in the spread?
Yeah, it's really interesting. I mean, according to the numbers, Block Island has the worst outbreak in the state by far, but I don't really believe those numbers. The denominators are too small, and the actual number of people on the island fluctuates too much. But Block Island has a big outbreak. Westerly has a big outbreak. Last week, Newport was up, though they're down again this week. East Greenwich has a big outbreak, and Nantucket has a huge outbreak. And what all that tells me is that at this moment in the Northeast, in many ways, this is not only a surge of the unvaccinated, it's also a surge of the rich and famous. That is, people who fly around, move around, go from place to place, and interact, looks like they're infecting each other. And that's unfortunate by itself, but what's even more unfortunate is that it's evidence that we haven't learned one thing. Because if we go back to the beginning of the pandemic, this is a virus that was spread by people of means who traveled all around the world. We had people coming from China to Boston for Biogen. We had people coming from China to West Germany for a car parts manufacturer who brought the virus from Wuhan elsewhere and spread it around. And I think we're seeing that again. And like I said, it doesn't look like we've learned a thing.
Yeah. The transmission level is high. It's at nearly 200 cases per 100,000 per week. Of course, Rhode Island's action level is at 100 cases per 100,000 per week. So just about double right now. Dr. Fine, Governor McKee and Dr. Alexander Scott are going to speak at, I think, 2 o'clock today. What does Governor McKee need to do?
Well, I think, he's worked hard on vaccination, and I think that's a great thing. I think, using every lever we have to get people vaccinated will be helpful in the long run, though it won't help us much in the next 4 to 6 weeks. So it's vaccinate, it's mask everybody and everything, and it's test in a coherent way. Vaccinate, mask, test, vaccinate, mask, test. Do the testing coherent and in a focused way, and commit ourselves to stopping community transmission. It's community transmission that matters at the end of the day, and that's what we have to be focused on.
We are going into a season of indoor concerts, plays, exhibits, etc. Many of these venues have said they're going to require masking. Obviously a tough thing to enforce in many of these venues as the event goes on. Not many people have the stamina or the desire to wear a mask for 3 straight hours, especially at a rock concert or something interactive. Talk about what the dangers of that strategy is.
Well, you know, this is a place where I've been disappointed in CDC, and disappointed in other health authorities because they have bought into this notion that either you need to, well, first of all, that testing for vaccination is going to stop spread, or having people prove vaccination, requiring masks by itself is enough. We just don't know that, and I would be loath to encourage or permit groups from gathering at this point. And it's something we're actually working on in Central Falls. But Josh, there's something else that has bothered me, and it's a place where I'm very sure that CDC has totally missed the boat. And that is telling people, organizations, and others that they should use a strategy of either get vaccinated or you have to mask and get tested. Now that's backwards. We should have everybody who's gathered together, vaxxed or unvaxxed, be tested twice a week like the colleges do. Every single person who's gathering needs to be tested twice a week like that. We're not saying that, and we are totally missing the boat, particularly for those big events. Those big events, people should be tested on the way in, and excluded if they go positive, and tested. If it were possible, I'd say tested with PCR. I'd really love to have them PCR tested within 24 hours and have a rapid test on entry. I think that's the way to get in front of this. But somehow, again, penny wise, pound foolish, day late, dollar short. We're dragging our feet on the basic and important public health measures that matter.
Since we spoke last on Tuesday, the Department of Health did issue strong regulations related to who is required to be vaccinated who works in the healthcare industry. It was a sweeping definition. It included volunteers, receptionists, security officers, etc. It was a little unclear in the regulations as to what the penalty was. I find it hard to believe that they're going to fine Rhode Island Hospital if a security guard is not vaccinated, but the message seemed to be strong, consistent, and based on science. What's your thoughts?
It was a great set of regulations, and I was glad to see it. I think it is a huge step forward, and very important not just for this pandemic, but for other stuff in the future. When I worked in state government, we did the first regulation about flu vaccine, something that I think was also based on science and quite important. That's ought to be our expectation of healthcare workers. Now, the real question is, as you said, not just about penalties, but about enforcement. We have seen over this pandemic, kind of a fear of any kind of enforcement. But until we put some muscle behind this, until if somebody doesn't follow the rules, we take away their license, and don't let them work or practice. The rules won't matter anywhere near as much. They're sort of good as a place to move people and get people thinking, but they've got to have enforcement behind them, and that's not just for doctors and nurses. It's got to be for CNAs and for EMTs, who are often not that well vaccinated.
Yeah, let's talk about it. Maybe the dentist's office receptionist doesn't quite matter. But one thing for sure is the CNA in the nursing home. We know straight out, especially with waning protection from these vaccines, that those who are vaccinated in December, early January, have a less protection than they did 6 months ago, and that about 50% of those working in nursing homes are not vaccinated. Is the Department of Health, the McKee administration, gonna close down a facility? Are they going to force the firing of somebody? Are they gonna penalize somebody with real monetary power? Just allowing to slap on the wrist is not going to be enough. It's going to send the message that you don't have to comply, and it will lead to further deaths.
Yeah, you and I totally agree on that. And what I'm hearing is that this virus is back in the nursing homes, by the way, even though people are vaccinated, we're seeing breakthroughs in nursing homes, and those breakthroughs happen when the virus is carried into the nursing home by staff. It's like either we kind of grow up and do this and fly this right, or we get one surge after the next, and feel like we don't know where it's coming from next.
Dr. Fine, you get the last word. What should people know?
Vaccinate, mask, and test. Vaccinate, mask, and test. Test twice a week. Doesn't matter whether you're vaccinated or not. Get it done. Let's do this together and get this thing gone.
Dr. Michael Fine, former Director of Health. I want to thank all my guests today. It was an education for me, Robert Rutley at Mott & Chase, top professors over at PC, one of the most interesting forensic experts, and of course, Dr. Fine. So thank all of my guests. Also, Dr. Fine said it, no place to hide, time to get vaccinated. There is just nowhere else to go. It's time to put on big boy, girls and pants, boys and girls pull up their pants and go over to CVS or Walgreens or your primary care physician or clinic and get vaccinated. It's just not responsible not to be vaccinated at this stage of the game. Thanks, everybody. Stay tuned for much, much more.
Thanks, Josh, and thanks for your stamina and focus. You've been critical through this whole thing.